bones, you've got a skeleton, you've got a skull, then you've got vertebral column, then you've got the limbs, so this is the type of skeleton. The blue one, the central one, is called as axial skeleton. The limbs, they form a pendicular skeleton. So, you've got different types of ossification on the two sides. This one is called axial skeleton, has got this axial skeleton. The central one has got intramembranous ossification. This is called intramembranous ossification. While the pendicular skeleton has got intracartilaginous ossification. So, ossification is bone formation. So, what happens? In both the places, the mesenchyme cells, the primitive mesenchymal cells over here, and also over here, mesenchymal cells, they give rise to osteoblasts. The osteoblasts would lay down bone. I would like to rub it off so that the things are clear. Now what happens in bone formation is that, be it flat bones for having intramembranous ossification, or when long bones, intracartilaginous ossification, the rules are almost the same. Supposing this is the bone, now what happens is that an ossification center appears in the, over here. This is called primary ossification center. Then certain other ossification centers appear. These are called as secondary ossification centers. But generally the formula is that the osteoblasts which are present where? Along the periosteum, these osteoblasts, they lay down collagen fibers. Collagen fibers are laid down in the formation of bone. The general formula is that first collagen is laid down. This is called as osteoid collagen, and this is soft. First there is vascularization, then the osteoblasts come in action, osteoblasts. Whatever the ossification, intramembranous or this one, there is the formation of hyaline cartilage over here. Then in both places the collagen fibers are laid, but this is osteoid, this is soft. Then it is hardened by the deposition of calcium in the form of hydroxyapatite crystals. Hydroxyapatite. Well, it is somewhat like this. This is calcium phosphate. This is the calcium hydroxide. Fine crystals, fine needle-like crystals, needle-like crystals in the form of calcium hydroxy apatite, they are deposited over here. This osteoblast is later converted into osteocyte. That is, now it has become inactive. First it was osteoblast, then it's inside the bone, forms osteocyte, then they have Hessian systems, lamellar deposition over here, and so this is how the bone grows. This is your epiphysis. This is your diaphysis over here, that is the shaft, and this one where the bone enlarges, it is called the metaphysis. Metaphysis, or ending up with epiphyseal plate. So this is how the bone enlarges on both sides, and it is being deposited. Salts are being deposited. Calcium salts, calcium. This is calcium. Calcium phosphate is being deposited in the form of hydroxyapatite crystals. These fine crystals, they are very compact in the center, forming the shaft, while on the ends there are fine spicules. These fine needles come together, form spicules, a meshwork, network that is called cancellous bone. You've got a cancellous bone. But well, if these are long bones, all the hyaline cartilage disappears except small amount of articular cartilage. So this is the remnant, this is articular cartilage. It is the remnant of hyaline, previously hyaline cartilage. This is how the bone is formed. So if there is deficiency of vitamin D in the diet, or the patient is not taking any lipids, or the lipids are being taken but they are not being absorbed. So in all these conditions what happens is there would be deficiency of vitamin D, and vitamin D, even if there is obstruction to bile salts, so the vitamin D is not being absorbed, and when vitamin D is not being absorbed, what happens is there is relative deficiency of vitamin D, and the bone formation is disturbed. Collagen is being formed, but this calcium hydroxyapatite crystals are not being deposited. So what usually happens is that the bone, the osteoblasts keep on proliferating, and so there is bulging of the bone. The bone is soft, but it enlarges on that side. It's bulging of the bones. And especially if the child is growing and vitamin D is deficient, the condition would be rickets. In a growing child, if there is vitamin D deficiency, the condition is called as rickets. But in an elderly person, the condition would be called as osteomalacia. That will be coming afterwards. So, if vitamin D is deficient in diet, you've got deficiency of calcium, little amount of calcium. If the liver is not doing its function, or the bile salts are not there, lipids are not being absorbed, again you've got vitamin D deficiency. Or if kidney is out of order because 1-alpha hydroxylation takes place in the kidney. So if the kidneys are not working and vitamin D is not being activated, so calcium is not being, again you've got rickets, but this time because the kidneys are what you call them as renal rickets. So renal rickets is the condition when the kidneys are not working, because the kidneys will not be able to absorb, to activate, to add 1-alpha hydroxylase. So I make myself clear by a repetition. So the renal rickets is that form of rickets due to kidney disease, because in kidney 1-alpha hydroxylase is absent because of kidney disease. So it's a renal rickets. Now I will talk about the deficiency and excess of vitamin, of calcium levels depending upon vitamins. So we know that the balance is 9 to 11 milligram%, right? And you know, out of this less than 50%, say about 4.5 milligram% is inorganic. This is inorganic, and about 5 milligram% or so is organic. This is organic level. So this is inorganic calcium ions. Which one is more important? This one is important, because if the levels fall, it will be perceived as hypocalcemia. So I told you they have to be there in proper level. If the level falls, and if the inorganic level falls, the body would take it as hypocalcemia. Hypocalcemia. Now what will happen in hypocalcemia? When the inorganic level falls less than 4.5 milligram%, the patient will suffer from tetany. It is called as carpopedal spasm. Carpopedal spasm. The condition would be because of neuromuscular irritability. It is because of neuromuscular irritability. Tetany, carpopedal spasm. Accoucher's hand, it's also called as accoucher's hand. So